off some of this. I'm so nervous. Good afternoon. My name is Dr. Michael Majak. I'm the chair of the Department of Physical Therapy. It is my pleasure to welcome you all here to our Doctor of Physical Therapy White Coat ceremony for the DPT class of 2020. We will begin today's ceremony with an invocation from Rabbi Baruch Fogel, campus rabbi for the Turtle Law Center, member of the Turtle Department of College Affairs. Please stand, Rabbi Fogel. John.
Avinu Shabbat Heavenly Father, bless all those who have assembled here today to take part in New York Medical College's School of Physical Therapy White Coat Ceremony for the class of 2020. Almighty God, Rofei Chol Basar Mafli Lasos, healer of all flesh and wonders in all your acts, you've instructed and empowered mankind to provide relief, comfort, and aid to all. We and all of those involved in this citadel of medical education are your agents in this task. May your abundant blessings always be showered on those who enter the halls of this institution. Give strength, courage, and fortitude to the women and men who now prepare to leave the classroom and engage in direct patient care. Bless them as they act as your agents to serve those in need, those in pain and discomfort, and all those who seek their healing. Grant them the wisdom and the strength to strengthen the weak and uplift those in despair. As our students begin the actualization of the knowledge that they have acquired, we pray that they constantly remember the principles to which they've been educated. May they always recognize each and every patient as the individual that they are, and grant them the ability to always acknowledge the interplay of body and spirit in the art of physical therapy. At this event, we also pray to you, dear God, that you shower your blessings upon the students and all their loved ones, parents, spouses, children, and other dear ones who have been there for support and encouragement, both financial and emotional, and who have helped them reach this milestone, who have sacrificed so much that they can persevere and succeed. May God bless the administration, faculty, and staff of New York Medical College and grant them the wisdom, resolve, and fortitude to continue their noble mission of strengthening community via education. Turtle College was created to serve, strengthen, and improve your world, dear God, your world with its rich diversity and ever-increasing potential for good. Dear God, we ask for your continued divine guidance so that we, together, can achieve that great potential. Amen.
Thank you, Rabbi Fogel. Please take your seats. So what a special day, what a special occasion. We are so pleased that many of the family members and friends of our first-year students can be with us here today, and that we're able to actually share the ceremony through live streaming on YouTube for those who could not be here to our lovely campus. I do ask for a moment of silence to acknowledge those family members and friends of our students who are no longer with us physically, but whose spirit continues to fill and nurture our souls. Thank you. Today's White Coat ceremony symbolizes and celebrates our first-year students' transition from the classroom to full-time clinical experiences, the application of knowledge gained to working with clients and patients in clinical environments as Doctor of Physical Therapy students. Doctor of Physical Therapy. That professional designation should not be taken lightly. The term doctor implies and creates expectations for many things to our clients and patients: wisdom, skill, compassion, guidance, demeanor. Interestingly, the term doctor is derived from the Latin term doctus, having been taught, learned, from docere, to teach. Thus, the term doctor in a clinical sense refers to a health professional who's acquired specialized knowledge and skill to impart to others. In that sense, becoming a doctor never stops. We are in a continuous stage of evolution. However, this day is not intended to be a joyous celebration of the completion of an educational milestone in becoming doctors of physical therapy. The ceremony today is an explicit expression of our students committing themselves to the professional and ethical obligations of a doctor of physical therapy as they begin their privilege of dedicating themselves to the care of others. A ceremony of reflection, introspection, and commitment. We are pleased to share with you this afternoon a ceremony with multiple speakers and perspectives of the white coat ceremony on beginning the clinical education component of a doctoring profession and on assuming the role of a doctor of physical therapy. I'll introduce the participants and guide our proceedings this afternoon. It's now my honor and pleasure to introduce to you Dr. Edward Halpern, the Chancellor and Chief Executive Officer of New York Medical College, and ask Dr. Halpern to share with us some of his comments. Dr. Halpern.
Rabbi Fogel, Dean Amler, officers of the School of Health Science and Practice, family and friends, and my dear young doctors. The standard speech when you have a job like mine on occasions like this is, you got a white coat, aren't you wonderful? Isn't the school wonderful? Isn't the college wonderful? Aren't we all wonderful? Let's go eat. There are instead three serious things I want to talk with you about this afternoon. The first is the problem of treating this event like it's a merry-go-round. You got on the merry-go-round of life and you leaned over and you caught the brass ring, and therefore hooray for you. There is very little as fundamental to the Western culture as the story of Adam and Eve, that you get a garment to cover your nakedness when you learn the difference between good and evil. The reason you get the white coat, therefore, is not because you caught the brass ring on the merry-go-round, because you are now going to have to fundamentally engage in the problem of evil. Children who need physical therapy because their biologic mother's partner has beaten the child within an inch of their life, has scalded them, they were in a car accident, you're an adult who was in an airplane accident, you have severe back pain, you have had a limb injury from a bomb in the Middle East, you have been run over in downtown Toronto, you have cancer. You engage in having a white coat because you know the distinction between good and evil. That's why you get the garment, not because you caught the ring on the merry-go-round. The second issue I think you ought to think about is what is called the retreat from narcissism. I've got to do really well in high school, and I've got to get really high scores on the SAT, so I get into college where I have to do really well, and I have to get really good scores on standardized tests, so I get into physical therapy school where I have to do really well and make it through the beginning of physical therapy school because they'll give me a white coat. And I just use the pronoun I have to really do really well about a half a dozen times in about 4 or 5 sentences. And then they give you the white coat, and it's not about me anymore, it's about the patient. You will very rarely meet someone in pain or with a disabling injury who wants to know if you're having a nice day. What they want to know is whether you can help me. So you put the white coat on, and it's not about you anymore, it's about someone else. That's what you got into when you went on this pathway in life. The third message I hope you'll take away from this afternoon is the problem of judgment. 2,600 years ago on the island of Kos, near what is now Greece, Hippocrates teaches what are now the fundamentals of Western medicine and write between 60 and 80 books. They are called the Hippocratic Corpus. The most famous of his books is called the Aphorisms. Aphorism means wise sayings. And the most famous of the aphorisms is, life is short, the art is long, opportunity fleeting, experience delusive, judgment difficult. Life is short, the art is long, opportunity fleeting, experience delusive, judgment difficult. We have a finite span of years on this earth, and what you need to learn to be a physical therapist will exceed the number of years you have to learn it. You will always be behind. You will always strive to be up to date. It comes with the territory of doing anything in the clinical realm. Get used to it. Opportunity fleeting. The chance to learn when you're walking the wards in the clinic is transient. Seize the opportunity to learn from your patients when the opportunity presents itself. Don't wait for the next case. The next case may not come. Experience is often delusive. Be careful of what you are taught. Some people do the same thing wrong for 40 years and call that accumulated clinical experience. Be skeptical. Rely on evidence. What you incorporate into your practice should be based on sound evidence and not someone who tells you that's the way I do it because that's the way I do it because I've done it that way. Experience delusive, judgment difficult. The hardest thing to learn, the innervation of a muscle, or for disease A, do B, the hardest thing to learn is clinical judgment. When not to treat, when not to recommend a procedure, when it's worth doing something. About 3 weeks ago, I consulted on a 21-month-old, a year-and-a-half-old with projectile vomiting, who was found to have a tumor of the cerebellum with metastatic spread in the cerebrospinal fluid. Now, I have been in this line of work for 40 years. I know what kind of chemotherapy, surgery, and radiotherapy to do. That's what I do for a living. But then comes judgment. Would you be willing to accept the long-term effects on spinal growth and muscular growth from craniospinal irradiation in a 21-month-old? Would you be willing to accept the injuries for peripheral neuropathy from vincristine in a 21-month-old? Would you be willing to deal with the effects of surgery on the cerebellum? Would you be willing to accept the death of the child from undertreatment if you didn't do those things? What is the price of cure? If you had to formulate a rehabilitation plan for a 21-month-old who will be status post-surgery, craniospinal irradiation, and chemotherapy, what would you do? What would you not do? What could the parents accept doing? What could they afford? How will it fit in with their ability to hold on to their jobs, care for the other children in the household? Judgment is difficult. Answering a multiple choice exam about what the right therapy is for posterior fossa ependymoma with metastatic spread in a 21-month-old is nothing compared to the judgment about what the right thing is to do when faced with those circumstances. Pay a lot of attention in this next stage of your life to learning judgment and acquiring that skill. I wish you all Godspeed in the next part of your journey, young doctors.
Thank you very much, Dr. Halper. We are delighted to have with us today the Dean of the School of Health Sciences and Practice, Dr. Robert Amler. Dr. Amler, thank you for being here today to share your perspectives.
Thank you very much. Good afternoon, everybody, and thank you, Dr. Halpern and Rabbi Fogel, for your remarks. This is a marvelous occasion. It's a celebration of some wonderful people, and as Dr. Halpern has pointed out, this is only the beginning. There's a lot more road ahead, a lot more to learn, a lot more to glean in the courses of your careers, and not just your course of study with us. I simply would like to add my respects to you as people who have committed to taking on this profession, a wonderful profession indeed. And this is a very significant transition from the academic to the practical and to the service side of what you are learning. It's great to learn things. As Dr. Halpern said, you can answer a multiple choice question, and that's terrific. And you have great knowledge, and you'll be accruing much more great knowledge about the functioning and dysfunctioning in the human body. But there is a transition here to applying what you've learned to the service aspect. We put on these white coats to show that we are a force for good. We put on these white coats to assure people that we will always have their best interest in heart when we confront them with whatever problems they need to have fixed. It is indeed an awesome responsibility. And an end to that gentle, comforting narcissism that is natural to feel as you move ahead in your career. When you begin to realize this is not just for me, this is for thousands and thousands of patients that I will see and I will do my best to help in the course of my career. So again, I congratulate you on this stage, and I hope you will have listened carefully to the provisos that have come from Dr. Halpern this afternoon. I would also say, as Dean of what we are very proud of, the School of Health Science and Practice, that this is also a joyous time for you and your families, and hope you will also remember the joy as well as the serious dedication that you feel today when you vest with your white coats for the very first time. So young doctors, my congratulations too, and my respect for taking on this great profession. Thank you.
Thank you, Dr. Amler. Along with the perspectives of the Chancellor Halpern and Dean Amler, we are pleased to share some perspectives of the faculty. So now Dr. Susan Ronan will share her perceptions representing the Department of Physical Therapy faculty. Dr.
Ronan. It's nice to have a pediatric vibe, for sure. So I wanted to share just some thoughts on preparation, which I also think that this coat ceremony is about. For a lot of you, when you start your profession and when you start as students, they don't just throw you right in. There's a ramping up period. You'll be able to observe, you'll be able to ask questions. Your mentor, your clinical instructor should be helping, guiding you through the whole process. And when you start as a therapist, it's similar to that as well. And where I started, when you were on acute care, they didn't start you in the ICUs. They started you in the regular rooms. And as you progressed in getting better and better and better at what you were doing, eventually you would find yourself in the ICUs. One of the last ICUs you would be sent to was the pediatric ICU. And so after maybe 2 years of clinical practice and actually feeling pretty comfortable in ICUs, as you know, it's a love of mine, I got sent to the pediatric ICU, which I was excited for the opportunity for and really, really nervous. And the first child I had to work with was someone who had a traumatic brain injury from an abuse situation. And when I went in to see this child, I was so scared. But I knew I couldn't show that on the outside, not in front of the parent who was there, not in front of the medical team. So I did the next best thing. I leaned on nursing as hard as I possibly could. And the nurses in the pediatric ICU, as they are everywhere in the hospital, know the patients quite well. So before I went in to see the child, I read the chart. I took a peek in the room to see who was there. And I went to talk with someone who was going to be my contact for the entire pediatric ICU stay. And that nurse's name was Holly. So Holly was brilliant and energetic and perfect at what she did. And I would watch her as I did my notes at the nurses' station, interact with parents and staff. And I noticed that as she was answering people's questions, when parents would come by, she'd take them by the hand, even if she didn't physically take them by the hand. And she would say, "How are you doing today? Oh, I saw your mother was in yesterday. How's that going? Oh, this." And she always had this moment where she personally connected with them. And after a couple of weeks in the ICU, I was talking with her and I said to her, "How do you do that? Because I'm up here and I want to be compassionate, but I'm so consumed with the job that I'm here to do. I don't know that I have the space to do it." And she put her hand on my shoulder and she said, "You know, Susan, you don't have to worry about that. Because preparation comes in stages. And right now you're just new to this environment." And she said, "When I was a new nurse, I was really scared about emergencies. What happens if someone has a seizure? What happens if someone has a code? What do I do? And she said, after I had enough experience, and I knew what to do in the codes, and I know what to do on the seizures, and I know how to handle this medicine, a whole space opened up in my brain and my heart where I now had room to really listen to what parents were telling me, to look at the children and see beyond what was happening with their pathology. And she said, your only problem is you haven't been up here long enough to have been through all those situations where you have the space to be able to recognize it and deal with it. So I tell you this because we are part of a larger healthcare system and we're part of a team, right? So it's a mistake to think that just by our own intentions and practice alone, we can help someone reach their goals. So you're going to be working, we all work to achieve trust with those that we care for by listening and investing our time and practicing mindfully. So we have this ceremony placed, as Dr. Majak said, at the junction of the first year of study and your first full-time clinical education placements. So although you've worked with people throughout the first year in lots of different settings, this will be the first time that you get to follow someone from their initial evaluation through their course of care. Do you feel prepared? So you don't have to worry about that either, because you know that our college, New York Medical College, has a rich history of preparing for service. And it goes back to its founding in 1860, where its founders sought to practice medical care with greater sensitivity and reflection, to care beyond the disease and recognize the complete person. So today we acknowledge your preparation, the class of 2020, as you continue your path as members of the healthcare team in service to the patients and families who turn to you to reduce suffering, restore function, and improve quality of life.
Thank you, Dr. Ronan. Shifting gears a little bit here, the thoughts of our alumni. We're very pleased to have with us today Dr. Angela Bonavita, who graduated in 2013. Dr. Bonavita is a staff physical therapist at Mount Sinai St. Luke's Hospital in New York City. You've asked her to be here to share some of her reflections as a recent graduate who has made the transition from physical therapy student to practicing doctor of physical therapy. Dr. Bonavita.
All right. Good afternoon, everyone. Can I? No, I can do it. Okay. Good afternoon, everyone. I'm so excited to be here. I'd first like to thank Dr. Majak and the PT staff. It is truly an honor to be here today. Being a doctor of physical therapy is something I am so proud of. But being a doctor of physical therapy alumna from New York Medical College is something I'm even more proud to say. So thank you. Now to the DPT class of 2020. Congratulations. You have worked so hard over this last year, and you should feel honored to wear those white coats with our crest on the arm. This is the true beginning of your clinical journey as a student physical therapist. I grew up with my father always quoting Vince Lombardi, an Italian immigrant who became one of the greatest football coaches of all time. The measure of who we are is what we do with what we have. Here at New York Medical College, you have been put in an environment to thrive and become the best physical therapist you can be. Please take advantage of every minute. Take advantage of every tool, every teacher, every clinician you encounter. It is not an easy road, but it is worth every minute of your time and every ounce of your sweat. You are working to become something better, someone who has the ability to change the lives of others. I think back to being a little girl, seeing my dad in a hospital bed and being told he may never walk again. That's not something a child forgets. But what I remember even more than that is the weeks and months after that moment, seeing my father work with his physical therapist day in and day out, seeing him take his first steps with a rolling walker after months of being in bed and multiple surgeries. That moment was not only a personal victory, but it was the start of my interest in something bigger. His PT did not only change my father's life, or more so his quality of life, but he also changed mine. As physical therapists, we do this every day. We are changing the lives of not just our patients, but their families, each and every day. Entering a doctoring profession should not be taken lightly. This is a large responsibility and should not be taken for granted. We have a responsibility to our patients, to their families, to each other, to our profession, and to the greater field of medicine. I'm an acute care therapist. I work in the cardiac ICU with people who have open heart surgery. Just the other week, one of the surgeons said to me, "The surgeons may be the one to save patients' lives, but you are the one who give them back their lives." This really hit home for me. Working in cardiothoracic surgery, I'm not the one performing the life-saving surgery, but I'm the one maximizing each patient's function and advocating for them to have the best quality of life. We are doctors who specialize in restoring, improving, and maximizing mobility and function. No matter what setting or which population you work with, you will be changing the lives of others. That is what we do as physical therapists. Every day isn't a perfect day. Every day isn't easy. But every day we are helping to improve the lives of others. Every day I wake up and I make the drive to Manhattan, knowing that no matter what I might be feeling at the moment or what's going on in my personal life, that today I'm going to help improve people's lives. It isn't about the paycheck or even the title. It's helping a patient to dangle on the side of the bed for the first time in weeks, or holding a family member's hand, or hearing someone's first words after months of being on a ventilator, or being able to see a patient walk out of the hospital doors after months and months of complications. It is these moments that make all the time, energy, sweat, and tears worth it. You are becoming doctors in one of the most empowering fields, and you are doing so with the best educational platform here at New York Medical College. So as you don your white coat and continue to work towards your doctorate, you should feel a sense of professionalism and pride. Being a doctor of physical therapy is not an honorary title. It is prestigious, and it is only earned after years of rigorous academic and clinical training that allow us to be autonomous practitioners. Being a doctor of physical therapy is the best decision I have made, and as you stand up here and get your white coat today, I hope you all feel the same. Congratulations.
Thank you, Dr. Bonavita. I thank all of our speakers for their thoughts and words and their comments, for helping to set the tone and atmosphere for the white coat donning of our first-year students. As a component part of our Doctor of Physical Therapy program, incoming students are assigned to a professional development advisor. Over the 3 years of the program, the advisor mentors the students, helps them to attain their knowledge and their clinical skills, and helps to transition from a student to professional clinical doctor of physical therapy. Today we'll have our faculty advisors be doing the donning of the coats with their advisees. And I'll introduce our faculty to you, and as I do so, ask them to take their positions in the staging area in preparation of assisting our first-year students with the donning of the white coats. Dr. Catherine Curtis can come forward and face the audience. Dr. Janet Delant, Dr. Nikki Goronsky, Dr. Gail Lavender, Dr. Susan Ronan, Dr. Christina Welsum, and assisting in the ceremony will be Fiona Viate, our Department Physical Therapy Administrative Assistant. I'll be announcing the names of the students as they come forth and don their white coat. We'll be announcing the names of students in groups. We ask that you hold off on your applause to one group has a coat don, and then you can celebrate with your family member their occasion. So first group of first-year students can step on up and join Fiona at the sideline there. So I'm going to mention off 6 names. They'll come up, and then we can don the coat and have an applause. Margaret Kernick, Brian Baracaldo, Mikhail Begg, Nicole Abamonte, Kendra Harrington, and Abigail Benstein. You can take your seats. Ryan Grunsteig, Emily Dickinson, Rachel Conti, Justina Gurgis, Amy Gladys, and is that it? Nicole Lipinski. I figure if I pause long enough, they kind of get the idea that, okay, now we go back to our seats. Okay, next group up. Daniel Jacobs, Nicole Ellis, Frank Dorigo, Jennifer Holzer, Amanda Off, Manhari Goodwin, Tiffany Karan. Nope. I lined up too much. Once again, Tiffany Karan. Twice. Molly Jekyll, Caroline Fitzpatrick, Faisal Hussein, Michael Perrone, and Michael Hogan. Andrea Matthew, Jinto Matthew, Nessel May, Laura Kelly, Noel Pickett, and Paul Kolesnik. Leah Mykovsky, Andrea Plate, Joseph Leo, Garrett Shunk, Neil Ryan, and Magdalene Kostadakis. Where's the big hook? Stephanie Rodway, Lauren Paxton, Tina Vietes, Cami Saraceno, Jenna Mittinen, I'm keeping them waiting to the very end, right? Daniel Scortia and Samantha Tripp. Thank you, Fiona and our faculty, and congratulations to all our students. As part of today's proceedings, our students are asked to attest to their dedication to the ethical and professional physical therapy practice by reciting a pledge for physical therapy. This pledge has been adapted from the APTA education section, and we'll have Dr. Nikki Growanski will lead the students in reciting the pledge. Will the students please stand? And any physical therapist in the audience who would like to recite the pledge a second time could also stand as well.
Yes, sir. Okay, please repeat after me. As I enter the profession of physical therapy to practice as a physical therapist, I solemnly and willingly pledge the following. I will respect the rights and dignity of all individuals and will provide compassionate care. I will be trustworthy toward my patients and clients and in all other aspects of physical therapy practice. I will place the welfare of my patients and clients above my own self-interest. I will provide accurate and relevant information to patients and clients about their care and to the public about physical therapy services. I will exercise sound judgment and comply with laws and regulations that govern physical therapy and protect the public from unethical, incompetent, and illegal acts. I will maintain professional competence and promote high standards for physical therapy practice, education, and research. I will address the health needs of society and strive to effect changes that benefit patients, clients, and the community. I will respect the rights, knowledge, and skills of colleagues and other healthcare professionals and seek consultation whenever the welfare of the patient or client may be advanced. I will respect the rights, knowledge, and skills of colleagues and other healthcare professionals and seek consultation whenever the welfare of the patient or client may be advanced. Thus, with this pledge, I freely accept the responsibilities that accompany the practice of physical therapy.
Thank you, Dr. Growanski. Take our seats. And I'll invite Dr. Catherine Curtis to offer some closing faculty remarks.
So in closing, to the students, this is a hard-earned day of celebration, a look toward the future. Your family and friends have gathered around you, marking your accomplishments to get to this point and confirming their support of your efforts going forward. I trust for many of you, your celebration will continue with dinner or other special time with your guests. This ceremony will go down in your own personal history as a major milestone, akin to your team's major win over your high school arch rival, your undergrad commencement, or one day a wedding if you choose. However, after the party and celebration has ended and you march forward in your studies and career, we hope you will carry forward some of what you have heard this afternoon. Because in essence, donning the white coat means flipping the mirror around and shifting the focus. Be it bedside at the hospital or on a plinth in the rehab gym, that white coat means giving all that it takes to help the person in front of you to have a better life. Whatever that might mean, endless calls and letter writing to insurance companies to fight for visits, or standing firm when the chief resident in the hospital wants to send your 89-year-old patient home alone when you know she will surely fall. The job is not easy, with heavy physical and emotional demands. Of all the professions out there, you signed up for this one. It was, remember that. It was the right fit, as you highlighted in detail in your application essays. And yes, we read every one word for word. And you worked very, very hard for the opportunity to sit for hours on end in uncomfortable chairs, or helicopter lift a classmate in ICS. As you have gathered by now, this is not just a job, but it's a calling. Some of your patients will climb into the back seat of your mind as you drive home at the end of the day or take a long car trip. If they do, that will mean you're doing your job well. As you endlessly roll over in your mind how better to tweak somebody's squat technique so they don't have knee pain, or how you'll get your 18-year-old with spinal cord injury standing for the first time, or how to just get Mr. Jones out of bed without him shouting expletives for you to get out. Well, as Angela had said, while physicians save people's lives, physical therapists help determine how that life will be lived, be it return to sport, regaining the ability to walk, or the chance just to go back home. You, in every sense of the word, count, and your responsibility is not small. The patient and their loved ones are counting on you as you temper your optimism with reality. But be realistic, but don't undersell your patients. However, despite the challenges woven into the fabric of that white coat, we want you to know that we're confident that you have all that it takes to be, in Dr. Majak's words, a great physical therapist. That is why we personally selected you and gave you the opportunity to sit for hours in those uncomfortable chairs. Often during the interview process, we're asked what we look for. First, strong academics. This is not easy, so you have to have some smarts. Second, play well with others. It's essential for PBL. And lastly, a caring heart, so that you do what is right and to get you through the tough parts. So to wrap up, I would like to thank all of our speakers for the reflective words, all of the family and friends for being here to make this a special day of celebration, and all the students for your hard work, dedication, and just plain being you. Thank you to you, and enjoy the rest of your evening and your celebration.
Again, what a great day. So before I conclude the program, I'd like to have one more round of applause for the class of 2020. And now I ask that the class of 2020 and faculty acknowledge the families, friends, and loved ones, both here and those connected by live stream and in spirit, who support the class of 2020 in so many ways. I also ask that we acknowledge Rabbi Fogel, Dr. Halpern, Dr. Amler, and Dr. Bonavita for their remarks and presence here today. And lastly, an acknowledgement to our faculty and Fiona and all the individuals who enabled us to offer today's ceremony. I now formally close the ceremony. However, I ask the following things. Students and stage party, please come on down here for a team photo to take. Families and friends, please exit carefully, row by row, to the lobby area. We'll join you in a little bit for a celebration. Thank you.